Vocal fatigue and vocal health issues are common, especially among professionals who use their voice intensively. Speakers, singers, teachers, broadcasters, voiceover artists, and online educators. This module focuses on recognizing the causes and symptoms of vocal fatigue, understanding how illnesses and lifestyle impact vocal performance, and learning sustainable practices for long-term voice health. Whether you're recovering from overuse or looking to avoid vocal burnout entirely, this module will equip you with evidence-based techniques, routines, and recovery methods to ensure that your voice remains strong, flexible, and expressive across the span of your career. 9.1. Understanding vocal fatigue. What is vocal fatigue? Vocal fatigue is a condition characterized by weak, hoarse, or breathy voice, dry throat, loss of vocal range or power, physical discomfort in the larynx or throat. It often occurs after prolonged periods of speaking, shouting, teaching, or singing, especially with poor breath support, excessive tension, or lack of rest. 9.2. Physiology of vocal strain. The vocal folds, cords, are delicate muscles that vibrate to produce sound. Overuse or misuse can lead to microtrauma or irritation, swelling, laryngitis, vocal nodules or polyps in severe cases, muscle tension dysphonia, MTD. Risk factors: speaking too loudly or for long hours, poor hydration, dry air or pollution, stress and poor posture, vocal abuse, screaming, harsh whispering. 9.3. Signs of vocal distress. Watch out for persistent hoarseness, difficulty hitting high-low notes, throat tightness or soreness, cracking voice, needing to push voice to be heard. Rule: if symptoms last more than 2 weeks, consult a voice specialist or ENT. 9.4. Vocal illnesses and impact on performance. A. Laryngitis, inflammation of the vocal cords due to overuse, infection, or irritation. Barrett's acid reflux, LPR, stomach acid reaching the throat can cause burning, hoarseness, and coughing. C. Allergies and sinusitis, nasal congestion alters resonance and airflow. D. Respiratory illnesses, colds, flu, COVID-19, bronchitis, all compromise vocal clarity and stamina. E. Neurological issues, spasmodic dysphonia, vocal tremor, less common but serious. 9.5. Immediate actions for vocal restoration. Vocal rest, absolute silence for 24 to 72 hours. Hydration, at least 8 to 10 glasses of water daily. Steam inhalation, loosens mucus and soothes inflammation. Humidifiers, maintain moist air especially in dry environments. Warm salt gargle, reduces irritation. Avoid decongestants, they dry the vocal cords. 9.6. Long-term voice maintenance routines. Just like athletes train and care for their muscles, voice professionals must maintain their vocal apparatus with consistency. Daily habits: warm up and cool down vocal cords, gentle humming, lip trills, sirens. Hydrate regularly, not just when you're dry. Avoid yelling, excessive whispering, or throat clearing. Use good posture to align vocal mechanism. Monitor volume and pacing when speaking for long hours. Nutrition: avoid dairy, can thicken mucus. Limit caffeine and alcohol, drying effect. Consume anti-inflammatory foods, ginger, turmeric, leafy greens. Lifestyle: get adequate sleep. Fatigue directly affects vocal energy. Manage stress tension, affects breath and tone. Exercise regularly to support respiratory strength. 9.7. Vocal warm-up and cool-down exercises. Warm-up, 5 to 10 minutes. Lip trills, gently vibrate lips on airflow. Humming, nasal resonance without strain. Yawning sighs, relax throat, stretch vocal range. Vocal slides, up and down glides for range flexibility. Tongue twisters, boost articulation and speed. Cool down, gentle humming at low pitch. Silent deep breathing to reset airflow. Neck and jaw stretches to reduce residual tension. 9.8. Professional voice care strategies. A. Voice coaching. Work with a vocal coach to identify vocal misuse patterns, Correct breathing habits. Develop a healthy speaking or singing style. B. ENT consultation. If you experience persistent hoarseness, pain, or loss of range, a visit to an ear, nose, and throat specialist, ENT, is crucial. They may use stroboscopy to visualize vocal fold vibration. C. Voice therapy. Speech-language pathologists, SLPs, provide therapy for nodules, polyps, muscle tension, rehabilitative recovery. 9.9. When to stop speaking. Pain or soreness in the throat. Sudden loss of voice. Feeling like you need to push out sound creaky, gravelly voice. Frequent throat clearing or coughing. Silence is not failure. It is part of your professional training. 9.11. Psychological impact of voice loss. Identity crisis. For many professionals, voice is tied to self-expression. Performance anxiety. Fear of future vocal failure can lead to tension. Social isolation. Avoiding interaction to protect the voice may reduce confidence. Professional support and mental health awareness are essential in managing this psychological burden. 9.12. Case studies. Teacher fatigue. A secondary school teacher developed chronic hoarseness due to shouting in noisy classes. Therapy revealed poor breath support and mic avoidance. Solution: amplification, vocal rest days, hydration tracking. Voiceover actor. Experienced sudden loss of vocal range before an audiobook launch. Diagnosed with acid reflux. Treatment: diet modification, anti-reflux therapy, voice therapy. 9.13 Conclusion. Your voice is a living instrument. It requires nurture, discipline, and protection. Without proactive care, vocal injury can become career-threatening. But with proper routines, regular assessments, and healthy habits, you can enjoy decades of strong, expressive voice use. Your vocal health is your professional capital. Treat it as such. I look forward to congratulating you upon completion of this course.